Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If you're one of the millions of people who suffer from hand pain due to carpal tunnel syndrome or wrist tendonitis, then you probably already know there are a few things you can do. These are non-surgical treatments that include resting your hand, splinting your hand, and wrist and forearm deep tissue massage. Splinting your hand can be extremely useful, but you probably already own a number of splints that don't seem to do much good. Do you use a splint but your hand still hurts? If so, the reason for this is quite simple, and that's that you're probably using the splint wrong. Actually, most people don't use a splint properly because they don't realize that if you have hand pain from carpal tunnel syndrome or wrist tendonitis, the sole purpose of a splint is to allow your hand to rest. And rest doesn't mean to put a splint on and then start working your hand. For proper hand rest, you cannot put a splint on and go back to the things that you were doing. Wearing a splint and stressing your hand at the same time will actually do more harm than good. Again, a splint is not for pain relief. It's a mechanism to keep your hand at rest and keep it from bending too much. As a rule, everyone with hand pain should splint at night while they sleep. Most people flex or extend their hand while they're sleeping, and this will impair the healing process. So to keep your hand from bending, night splinting is crucial to having healthy hands. In contrast, if you use a splint during the day and insist on straining your hand, then fighting the splint is going to be a lot worse for the healing process than not wearing a splint at all. Therefore, use a splint only sparingly during the day. And during the day, try to avoid or eliminate those hand activities that you perform that are making your hand sick to begin with. Even with rest and splinting, don't forget the advantages of deep tissue massage of your wrist and forearm. When you discuss carpal tunnel syndrome with your doctor, make sure you understand why most people who have carpal tunnel surgery are dissatisfied with their results. But the vast majority of people who have non-surgical therapy are quite satisfied. Your doctor should candidly and openly inform you of this because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Once again, those non-surgical treatments that everyone should use first are resting your hand, splinting, especially at night, and deep tissue massage, which is almost 100% effective in relieving symptoms. But it must be applied professionally and every day for at least 2 to 4 weeks. Anything less or improperly applied is useless. And to get professional and effective deep tissue massage therapy for carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.